Hello, and welcome to another episode of the Melbourne Athletic Development Podcast. Today, I'm very fortunate to have with me Dr. Felix Leung. Felix, thanks for being with us this morning.
Morning. Thank you for having me.
No, pleasure. So, to begin the conversation, can you give some context to who you are, what you do, and obviously specifically the research that you're involved in? And we're going to go take a deep dive into that.
Yeah, excellent. So I'm a physiotherapist, and in the last 14 years, I've been working in primarily sports and musculoskeletal physiotherapy. Started off in a medium-sized private practice, and then from that embarked on a PhD, and through the research I've conducted there, now I'm working at Griffith University as a lecturer. So I teach into the Bachelor of Physiotherapy program, and my research focuses on sports-related concussion. So like I said, my PhD early days focused on adolescents and how they, what happens after concussion in this particular cohort, and now currently do concussion research on a number of different athletes across a whole, array of sports.
Is there any particular reason why you got into that topic? Are you particularly interested in concussions? What actually sparked that interest?
Well, it was actually I started working as a research assistant at Australian Catholic Uni at the time, where my former supervisor and current colleague, Professor Julie Hydes, that's where she was working, and the research that we were involved in was a lot on injury risk prediction and identifying factors that may predispose like elite athletes to muscle injuries, looking at muscles of the trunk. From that, we actually start to see that there was also a correlation between trunk muscles and sustaining a head and neck injury and concussion. And that's kind of where our research team then started looking into was concussion. And then from there really evolved into just identifying what physios can do in management of athletes who've sustained a concussion.
As I know I briefly mentioned in the email, I've been interested in reading some of Julie's research of looking at that relationship between the lumbar spine, or specifically looking at things like lumbar multifidus, and the relationship to peripheral injuries, because straight away that's an interesting connection to think about how the mechanics or tissue capacity of the lumbar region can affect upper limb, lower limb injuries, or the head and neck. And for me, I find that particularly interesting because I'm particularly fascinated in fascia and thinking about how that does provide literal physical connections to the body. And that sort of got me down the pathway of thinking of, well, is there something to do with how forces are then transmitted through the body that then influence, high concentrations in the peripheries, whether it's be the arms, the legs, or the head? Can you talk a little bit about some of the research that you have been involved in with concussions, and specifically what you looked at and what were some of the findings from those studies?
Yeah, so my research looked at doing a baseline screening of a number of different measures and then following up these athletes. So I conducted a study looking at over 200 athletes, adolescent rugby players, measures on balance, the vestibular ocular system, as well as the cervical spine. One of the measures also in regards to the balance and trunk was the imaging of the lumbar multifidus and how that might change following a concussion or any potential risk factors to whether if, from a lot of Julie's work, if there were smaller muscles or poor ability to contract those lumbar multifidus muscles, was that a risk factor for developing any injuries. So from my study, we found that there were some changes in those trunk muscles following concussion. And a lot of that we're proposing is to do with the way the trunk and the body kind of functions to control movement, and then lumbopelvic control, or the lumbar lordosis. And so that was really the finding from that study, was that it changed. And a lot of that work is really kind of mechanistic, looking at, okay, the lumbar multifidus might be a good indicator of the ability to control the trunk and dissipate forces, whether that's lower limb injuries or impact forces from the head through to the spine when tackling or getting a concussion. So that's kind of where that work was quite interesting, in how that changes potentially overall trunk muscle or function of the trunk. And then some of the other results from my earlier work in that cohort of adolescent rugby players was that following concussion, there were changes to the vestibular ocular system. And at the time, it was still like a 3-week kind of stand down period or 3-week return to play protocol. And even following that 3-week period, a lot of these adolescent athletes, their vestibular ocular system hadn't returned back to their baseline. And which is quite interesting because they report that they don't have any symptoms. So whether that's because they're underreporting their symptoms or they genuinely don't have any symptoms despite having vestibular ocular deficits, we don't know. And that kind of really steered us towards wanting to identify more objective ways to assess and determine if athletes or kids are appropriate to return to sport following a concussion.
Let's go to the very beginning of actually defining what a concussion is, because I think that's actually a good place to start, and then we'll start diving into thinking about some of the deficits associated with concussions.
Yeah, so concussion is a form of brain injury or traumatic brain injury. So when you get that impact to the head or anywhere in the body, that transmits that impulse to the brain. It sets off a whole heap of physiological and metabolic changes. And part of that manifests as symptoms that can be quite varied and ranging amongst different athletes. So those are the symptoms. You may also get signs of concussion that manifest from this impact to the head. Typically, a concussion will resolve spontaneously. Okay. And also, I guess the signs and symptoms may evolve over a bit of time. So what you feel immediately might not be the case a couple of minutes to hours or days later. So following that incident, it may take a little bit of time for that patient or athlete to feel the full kind of effects of that concussion. It affects emotional, it affects behavioral, it affects physical and cognitive kind of domains as well. So quite wide range of symptoms. And
how do we?
Sorry,
I was going to say actually, how do we recognize concussions then clinically?
It can actually be quite difficult, and we heavily rely on symptom reporting by the athlete. So they may report those physical symptoms like dizziness, headaches, neck pain. They may report those cognitive symptoms like difficulty remembering or concentrating or that fogginess in the brain. And they often, when they return to work or school, just feel hard to concentrate as well. So those are really clear signs that they've had a concussion. Behavioral changes or emotional type of changes. So I've seen a lot of athletes, following a concussion, get quite emotional after the game. And not necessarily because they're an emotional person, but they just start crying. And that's an actual really common symptom or sign of concussion. So, you might ask, okay, well, what if someone is just emotional? But what we need to know is that to have sustained a concussion, you need that incident. You need that plausible mechanism where there was some sort of contact or collision that's resulted to that impulse to the head. Yep. Then you look for these symptoms that the person might report. But then the signs of a concussion, some can be quite obvious, some can be quite difficult. So obviously the loss of consciousness, which only occurs in maybe 20 to 30% of concussions, that's a really obvious one. But then there are other signs like stumbling or that ataxia. Is a really clear sign, which if you watch any of the NRL or rugby, we call them category 1 signs or mandatory signs for removal. So that stumbling, that loss of consciousness, those are really clear indications for us to remove and that they've had a concussion. But then there are other ones that, they're a bit slow to get up after a collision. Is that a concussion? And that's where we then kind of rely on what the athlete might report, or just looking at how orientated to time and place, or do they still know what's going on in the game, and maybe even the reporting of other players that that player seems a little bit off after that. He doesn't remember the plays in the game or anything like that.
You've mentioned a wide array of different symptoms that people can experience following concussion. So there's behavioral, emotional elements, vestibular, ocular, and cervical symptoms, and associated with all that balance. Do these symptoms come from essentially just inflammation? Because I think about, obviously, with a concussion, you're getting a large movement of the brain that can potentially cause neuroinflammation. Are we seeing the same things with, say, the eyes or the vestibular apparatus or the neck with like a whiplash injury, where you're getting localized I guess some level of trauma that causes inflammation and dysfunction of these systems?
Yeah, so it's definitely, so a concussion is a brain injury, so there's definitely
Mm.
that component going on in the brain. But because of the mechanisms that are involved, often that whiplash-like mechanism, that high impact to the head, yes, you can also get, concurrent kind of vestibular, so peripheral vestibular issues, as well
Mm.
as that cervicogenic issue similar to whiplash. So there are things that just require time for the brain to recover and heal
Mm.
and recover. But then some of those peripheral systems, so the peripheral vestibular and the cervical spine, that may also be contributing to this whole kind of symptom presentation. That can also be treated, which is why there's a big appreciation of the role of physiotherapy
Mm.
and the skills and the rehabilitation side of things that we can do to speed up recovery or
Mm.
get on top of these peripheral dysfunctions so that the person can recover quicker. But the brain still needs its time to do its recovery as well, though.
Yes, yeah. It seems that the process of something like brain inflammation is a much slower process than some type of more peripheral or musculoskeletal type of inflammation.
Yeah.
Yeah. Now, before we talk about, say, the relationship of looking at the lumbar spine to concussion injury risk, what about just more local tissue capacity when we think about, say, like neck muscle size or bulk? Is there some correlation to that, to concussion injuries as well?
That's a great question because that's kind of the really interesting stuff that we're working on right now.
Mm.
And there's a big interest. There's a lot of interest in the neck muscles and whether that the strength of those muscles or the ability for them to contract quickly at an impact can reduce the risk of concussion.
Mm.
So the evidence is still quite mixed. That's probably where it's at the moment. There's
Mm.
some that say, yeah, the strength of these cervical muscles can reduce the risk, but then there's others that say that it doesn't provide any, any protective benefit. But
Mm.
our preliminary results from some of our studies on adolescents and in elite level rugby league athletes have shown that there is something interesting, something to look at here with strength, and that,
Mm.
yeah, reduced strength of these muscles may increase that risk of getting that subsequent or that concussion during the following season. So that's one thing that we've looked at, and we know that people are already doing neck strengthening
Mm.
in certain sports from a physical performance perspective, but also a lot of sporting teams are now doing neck strengthening for a concussion kind of prevention type of strategy. So there's more to be researched on,
Mm.
but it's showing promise. The other areas that we're not just purely looking at strength, but also proprioception of the neck, that ability to position your head maybe during a tackle or at impact and that type of thing. Is that going to increase that risk? We haven't found anything yet, and a lot of
Yes.
the evidence probably right now shows that the proprioception. So there's a few studies that are looking at proprioception that have shown that it is a risk. We just haven't found any in our kind of studies recently. And
Mm.
then neck endurance. So the endurance of those neck flexor muscles and that ability to kind of maintain that, position of the head on neck. Once again, for that one, we haven't seen too many interesting results from that. So we're looking at a number of factors around neck function, but strength seems to be the most promising one.
Is there any indication that there's a correlation between the curvature of the cervical spine to concussion risk? Because I think about that, like maybe and we'll talk a bit more about the findings from looking at, say, the lumbar spine to concussion. But one of the indications when you think about, say, the size of the lumbar multifidus is its impact on lumbar lordosis. Do we see a similar relationship with the cervical spine, or is that still one of the unknowns that needs to be figured out?
Once again, a really good question because these are all the things that we're working on right now. Like,
Okay.
that link, where we get asked, well, what's that link between the lumbar spine and lumbar
Mm.
multifidus and
Mm.
that risk factor of head and neck injuries and concussion? Well, from our study, we're seeing a correlation between the size of the lumbar multifidus. So our hypothesis, that's the indication of that ability to maintain that lumbar lordosis. And
Mm.
with that was correlated with greater neck strength. And what we think is that, the ability to maintain a better lumbar position helps the cervical spine generate greater forces. And we know that obviously, muscle size and force, is that a weight kind of relationship? From what we've found, it's not. And that we do think that it is just the lumbar multifidus, and that ability to maintain the spine position helps with the cervical spine in generating greater forces by putting potentially that cervical spine in that lordosis as well. There's other studies that have shown that relationship, that lumbar spine position affects the cervical spine. And what we've kind of shown is, lumbar spine muscles is correlated with greater force generation at the neck.
Yeah, well, and can you actually elaborate a bit more on some of the research that you've done in this particular area? Because I recently reviewed a publication that you were involved with, Julie Hydes, of looking at lumbar spine characteristics of concussion. I know you specifically looked at lumbar multifidus size and chondritis lumborum, and you also then looked at the activity of some of the lumbar and abdominal musculature. So can you elaborate a little bit on some of those findings?
Yeah, so a lot of those studies really it's showing that greater size of the lumbar multifidus is more beneficial, or smaller size increases your risk of injuries, and reduced ability to isolate that contraction of the lumbar multifidus, also increasing that risk of sustaining injuries or concussion. And that's quite consistent across that work, where whether that's lower limb injuries, upper limb injuries, and concussions. So what we think is causing, or what we think is presented here, is that these muscles kind of indicate the ability to control the spine, and the lumbar position is really important in dissipating forces, whether that's landing forces, so lower limb kind of ground reaction forces, or forces from the head and shoulders during a tackle or a collision. So it's the ability to dissipate forces and dissociate movement is what these muscles are kind of telling us is going on. And therefore, the inability to do that effectively potentially increases that risk of sustaining a concussion. And we also need to realize that concussion is multifactorial. So, this is one thing. Strength could be another. There's many other factors. We're even thinking vestibular ocular function, their ability to coordinate head and eye movement, and, gaze stability and eye control. All that all has, something to kind of mix into this, the concussion prevention type of thought.
The other interesting finding from that recent publication that I thought was interesting was looking at the activity of things like the lumbar multifidus and even some of the abdominal musculature. And in fact, excessive EMG activity was associated with an increased risk of concussion injury. And I thought that was interesting as well, because, and then tell me what you think of this and whether it makes sense. But if you develop strategies where you're actually overactive, where you're rigid and you're excessively stiff, the ability to be able to dissipate forces through your myofascial system is more impaired. So there seems to be almost a bit of a fine balance where you need to have a certain amount of muscle size and most likely strength, but that excessive rigidity also too may impair the body's ability to be able to absorb and dissipate forces.
Yeah, yes, no, that's definitely exactly what we're thinking there. It's almost like we need a sweet spot for the muscles to be, or the size of these muscles. But yeah, that the contraction. So to clarify, the research that we've conducted doesn't look at EMG.
Yes.
It is ultrasound assessment of the muscles, so QLs, so quadratus lumborum, and the abdominals. But yeah, what we're seeing there is that that larger size, greater QL to multifidus kind of ratio might indicate more of that splinting mechanism and that inability, once again, to then dissipate forces. So that dissociation of movement. So that was kind of the work from also when I looked at the PhD, was that following a concussion, those muscles actually increased following the concussion, leading us to think that, yes, it is more of that braced strategy of movement following concussion as well. So there's studies that we've looked prospectively, and there's studies that we're kind of looking, cross-sectional, looking at history and, what that changes as well. But yeah, splinting also isn't great with dissipating forces, which may then also increase your risk of developing injuries.
Mm. The other thing I thought about with this study was um, something that I've been really fascinated in following is some of Paul Hodges' research over the last 5-10 years. And I don't know if you've looked at some of his research looking at animal models where when you create a disc lesion, it causes an increase in fibrosis of the multifidus and of the lumbar multifidus. And interestingly, the fibrosis occurs more specifically around the muscle spindles and the perimysium that seems to impair the function of the muscle spindles to work properly. And so, and this is just me extrapolating, so I could be completely wrong here, but I wonder if there's a similar mechanism in play here where, say, from following a concussion, you're getting atrophy of the lumbar multifidus, but maybe actually connective tissue changes that impairs its proprioceptive ability, and whether that has then subsequent effects for how we contract through our myofascial system to dissipate forces as well. And this is obviously purely speculation, but just sort of my extrapolation from other findings.
Yeah, look, that's really interesting. I'm not familiar with Paul Hodges' recent work or anything like that. But no, look, in our studies, we do kind of obviously screen low back pain as a potential confounding factor, but we don't have any it's not correlated. There's no low back pain in any of our findings.
Yes.
It's purely just like what might the concussion do to the rest of the muscle or trunk muscles? Nothing in terms of that isolated level that we are seeing. So it's more just like, at a number of these where we see that trend in those changes. But that's an interesting thought. Yeah.
Well, now, you've mentioned too about vestibular and ocular motor screening. Can you elaborate a little bit more on what that actually is and how we can actually go about assessing this?
Yeah, so the most common one that's been mentioned around now with concussion is the VOMS, the vestibular oculomotor screening tool. And that's a 5-minute kind of protocol where you run through a very kind of scripted assessment that involves just smooth pursuit. So I follow saccades, so that quick kind of flicking between targets, and then near point convergence. So as some target's coming towards you, when does that target kind of split into two or gets bit like a double vision kind of vision?
Yes.
As well as some head movements while you're focusing on an object. So that 5-minute protocol looks at symptom provocation, where we get the person to rate how they feel before: headache, dizziness, fogginess, and nausea. And then after doing each of these tests, they rate those symptoms again. And that's a quick screening for the use of diagnosis of concussion, where, if they increase the symptoms by greater than 1 or greater than 2 in some reporting, then that would be indicative that they've, potentially got a concussion. So that's a screening tool, and it's really useful for concussion. But then what we need to do after getting a positive for that is then to actually do a comprehensive vestibular ocular assessment, to do each of those things and not just look purely at the symptom provocation, but also look at whether we are seeing abnormal eye movements. So, for the vestibular neurophysios, they're looking at things like overshooting of eye movement, any saccadic intrusions, a nystagmus, or slow or usually slow, but really slow saccades that might indicate abnormal function on top of that screening of just symptom provocation.
Does it work both ways, where you're seeing impairments of these things following concussion, but if you do it as a screening for people who do have impairments who haven't had concussion, are they more susceptible to injury as well?
That's a great question, because there's two parts of that. Firstly, yes, we are seeing that if we do this screening or just do a comprehensive vestibular assessment on general athletes, athletes who either haven't had a concussion or currently are not concussed, we're getting quite a large number of abnormal findings, and that's across adolescents. We've done that in. And then some of Dan Brown's work in combat sport athletes have also shown that increased prevalence of abnormal function. So that's definitely something that we're seeing, which kind of leads us down to kind of two paths. Do we need to do some interventions to see if we can improve that? Or are these kind of existing things that are indicating that, the issues from playing some of these sports? So it really does lead us to think, we should do some interventions down the line to really reduce those, those deficits. And we also have seen in some preliminary results from some ongoing studies is that symptoms that athletes report at baseline are correlated with an increased presentation on this screening. So really, it's kind of really matching that we should be doing something. And not all of these are full contact sport playing athletes either. So
Yes.
it could just indicate, developmental, delay, or not necessarily delay, but just that adolescent awkwardness where, during that period, things kind of are trying to get used to the maturation or the growth spurt and all of that. So there might be some sensory integration occurring there.
But
And then in adults as well, we're seeing that.
Yeah, it's interesting that concept of coordination or like motor learning capacity as a general term. It's something that I've thought about and talked about on the podcast with guests, and it's something that I think I look at a lot just from a screening measure for a lot of athletes, both from an injury prevention or rehab perspective, where it's obviously good to be able to have good tissue capacity in terms of flexibility, strength, power, and so on. It's good to have good mechanics of the movement that you need to do. But then it's an interesting observation to look at people's coordination when you give them a task that they're unfamiliar with. Because some people seem to have a capacity to do it very well and some people don't. But I've never actually considered about then maybe looking at, is that correlated to vestibular ocular function? And again, this is just me just thinking out loud, but perhaps there is some correlation or connection there that, and obviously in this situation, can predispose you to concussion injury too.
Yeah, yep. So that's what we're actually wanting to look ahead in seeing if those deficits do increase that risk of concussion or any other type of injuries. Yeah, definitely. If you search up the literature, vestibular ocular kind of, keywords, a lot of that is in either, people with neurological conditions, concussion and all that. No one's really looked at them from healthy athletes' point of view. So
Yes.
although some of the tests that we do probably aren't going to help us identify, are these are really well coordinated ones or these are a little bit off, it's definitely something that I think has a little bit more to add to the whole picture of injury prevention. Are there better ways that we can test that kind of coordination or hand-eye coordination, eye-head coordination to really determine could those that have less than optimal, could those be at greater risk of developing or sustaining an injury, whether it is concussion or whether it is those non-contact injuries, because they're just not tracking things quickly and maybe they do a movement, injure a knee, that type of thing.
Now, I've also heard people talk about dysfunction of the jaw associated with concussion. Is there actually any research looking at certain indicators of temporomandibular function and its susceptibility to concussion? Or is there any actually, are people out in the field looking at trying to prevent or treat concussion look at the jaw? Or is that something that hasn't really been explored much?
Look, I'm not aware of anything at the jaw, with concussion. I know, there's always been those kind of marketing sales pitches about mouth guards and how that might support the jaw. But look, I'm not familiar with that area at all. And I'm not aware of anyone looking in particular at the TMJ and concussion risk or anything like that.
When it comes to then looking at, we've talked about the assessment of different receptors or areas of the body like the cervical spine for concussion injury risk. What kind of interventions are people looking at applying to restore function of these subsystems? I mean, are these looking at certain exercise modalities? Is actually something like manual therapy used a lot, like at least clinically? I'm not sure that there's necessarily good evidence or research to support that, but I'm just interested to see if you've noticed any observations in the field.
Yeah, absolutely. So this is where physios are in the best position to really treat people with concussion. When we're talking about those, the secondary type of deficits, like of the cervical spine, we get a lot of our understanding of how to treat these from our whiplash literature.
Yes,
so
okay.
absolutely. What we know about whiplash, what we would be doing for a rehab point of view, we would use manual therapy. People are using manual therapy if it's really clear and obvious that from that concussion, they're getting a cervical joint, a facet joint, issue.
Yes.
we
Okay.
would use manual therapy there. And then the muscular changes. There's been research that shows there's a reduction in strength, reduction in or changes in proprioception after a concussion. So we would then do our, deep neck flexor, our overall cervical muscle strength and endurance training, and then we would do some proprioceptive training there as well. So we pretty much get what we know from the cervical spine, from what we do as physios, and we can apply that to concussion if that's what they're presenting with on an assessment. I guess we identify the impairments and then treat that. So if they're presenting cervical impairments, then we can treat that with what we already know. And then the peripheral vestibular ocular kind of issues, where if we see things that are presenting like that, then we apply it to the same kind of rehab, vestibular rehab modalities, gaze stabilization training, adaptation, habituation, those type of treatments. And look, I'm not a neurophysio, but I'm sure there are neurophysios out there that are very, very skilled in that area. So it is also about then, referring to those colleagues who are vestibular and neurophysios that know that. So I think really useful for physios working in sport is to have a good appreciation of that. Yeah, after a concussion, these impairments can present. Okay, if you're comfortable or if you're capable of treating those early, yep, definitely you can start that. But then if it does get complicated, then referring on to those other physios who have that greater kind of skill set in treating the vestibular and ocular and those neuro type of issues.
Yeah. What observations are you seeing then in professional contact sports? Like obviously rugby and rugby union and rugby league have a high prevalence of concussions given the nature of the sport. And when I think about the development of rugby players, there's obviously a lot of contacts, both in training but obviously particularly in games. There's a demand for doing a lot of very high force, high velocity development in their training because they obviously need to develop the specific tissue capacity. Do we see that there's a trend now, or have you observed a trend where they're actually trying to apply some of these type of interventions to mitigate concussions, or is there a bit of a challenge with trying to balance out all their training demands with trying to do some preventative stuff for concussions?
Yeah, there's definitely, time is a big issue. There's a lot of things that these athletes are doing, training and all of that. But then we are seeing a big uptake in concussion prevention type of measures. So, like I said earlier, a lot of teams have already started doing neck strengthening as a concussion prevention type of strategy. And that's, that's despite the evidence is still a little bit uncertain, but people are already doing it. So it's great to see that teams are being proactive with these measures, and then the rehab side of things, I think it really depends on the physio. How on top of the knowledge in treating concussions they are, but then good thing about elite sport is if something that they don't feel comfortable with treating, then they can refer on quite easily and quite quickly to the right people like neurophysios to treat those complicated type of concussions. But yeah, concussions definitely something on the top of everyone's mind in these elite sporting organisations, and that's quite good and out for us that they're really on top of that they're really supportive of the research that we're doing. Giving us access to the players to really help understand what are some of the more likely risk factors to concussion.
Out of interest, you talk about them doing neck strengthening stuff. What kind of stuff are they doing? Are they doing a lot of resisted work and doing? I can't think of the names of the exercises off the top of my head, but some of the horizontal positions where you have a band around your head and you're doing almost planks and things like that. Are they the kind of things that they're implementing?
Look, good thing to know is that they are all in quite functional positions. So it's, it's not like those simple, maybe deep neck flex exercises that we would do for whiplash patients. They are in quite functional positions, band or cables, in a standing position or in a, kind of like a scrum position where they're doing a lot of, isometric or, isometric kind of keep your neck still as someone's pulling on the band. They're doing a lot of band, adding in different directions of movement and all of that. I guess a lot of those have been on more force generation. I haven't seen too much on kind of reaction time and, yanking unexpectedly to the head or anything like that. But,
Sure.
like, yeah, there's got to be a balance between, and from the reception that we get with some of our, researchers, we wouldn't be doing anything to try and, that could potentially lead to injury. So that's why they're doing these strengthening protocols that are quite controlled and controlled and measured.
Is what about things like range of movement or flexibility or strength through range? Because again, when I think about people who are susceptible to concussions, rugby players, combat sports, they obviously get a lot of rigidity in their neck. Is that something that can be correlated to injury risk, for like concussion injury risk as well? And are they looking at implementing strategies to mitigate some of the side effects from their sport with range of movement or strengthening through range?
Look, strength through range. Look, it's a really good point. The only problem for us is it's really hard to measure. That's
Yes,
probably
okay.
one of the So a lot of our testing, it needs to be reliable from a research, test retest reliability or intra-rater reliability, and it's difficult to test the strength in different ranges type of thing. So we haven't looked at it, but I think that's a really important consideration, is that strength through range.
So someone needs to bless you. Someone needs to develop a like isokinetic dynamometer for the neck, I think, perhaps. And could be some interesting findings there. What about then for going back to thinking about the connection between the lumbar spine to concussions? Do you see similarly interventions being applied to maximize tissue capacity of the low back to reduce concussion? Or I guess perhaps they're already doing that anyway, based on the demands of their sport.
So once again, the interventions, what our research kind of shows is that we should look broader than just the head and neck for concussion prevention strategies, and to look at the lumbopelvic region more from a movement control point of view. Can we improve that ability to position the neutral spine, dissociate spine and hip movement? More about movement control than it is, sitting there and doing specific, like, like lumbar multifidus contractions or anything like that. It is more about your bigger, more functional carryover of our results to making it relevant and sports specific. Yeah.
Well, I imagine particularly in rugby players, you see a lot of rigidity in a lot of those players as well, just based on the demands of their sport.
Yeah, and absolutely. Like if you look at, when front rowers going in for a scrum, like that ability to really, and the front rowers have a really good ability to control their spine, because they really need to leverage on that, spinal control or spinal curvature to maximize that force generation. So like, funny enough, they're the ones who've got great control. And multifidus and contraction of those muscles, they've from what we've seen, they've been actually quite good at that. So we do think, it's the muscles there are an indication of the ability to control movement of the lumbopelvic region. That then leads to us thinking, okay, it's movement control through there. That is the kind of link between, concussion risk, as opposed to isolating those muscles themselves and okay, it's that muscle that's causing the problem. No, we're thinking more the overall movement and control of movement.
Recently there's been a lot of talk in sports medicine about training loads and thinking about injury risk associated with training loads. Is there any indications, maybe from a research perspective, but even maybe anecdotally talking to sporting clubs, of seeing a correlation between training load, fatigue, and concussion risk?
Yeah, I'm actually not too familiar with that literature, because I know there is a lot out there on, when in the match concussions are occurring. That might obviously then kind of relate to,
actually, out of interest,
fatigue.
When do they occur then? Usually,
I don't know. So that's where I'll go. But like, if you just look at anecdotally, like, they often occur quite early in the game when everyone's hyped up and then going for those big hits. But then you can also counter that argument by also, there are the ones that occur when they're fatigued and, they put their head in the wrong spot. So look, like I said, I'm not on top of exactly what those, what that research is saying, but training load is definitely an issue. I know a lot of teams will try to train things under fatigue. And then, it is building up that capacity to then still function and perform well under fatigue as well. So,
Well, and that's the thing I think of too, of whether they're, I think about vestibular or ocular function or proprioception. That is also, very dynamic. It's changing a lot. And I wonder whether you see changes where as you get more fatigued, that becomes more impaired and there is an increased risk of concussion as well. It seems plausible, but I'm not necessarily sure if anyone's actually looked at that yet.
It seems, yeah, no, it's very plausible, and it's once again you're picking out all these research ideas that I have as well,
Yeah,
and
yeah.
yeah, because the vestibular ocular kind of focus has not really focused on athletes in the past, so
Mm.
I think that's a great little research project looking at vestibular ocular function, go and put them under fatigue and reevaluate that, and then see if that increases, or sorry, see if that see if it changes after fatigue.
Well, it sounds like you've got plenty of work cut ahead for yourself, Felix, to get all this done. Um, at the moment, then, really, when you think about the current state of looking at concussions and concussion prevention, what are
Yeah.
some of the key things that really people need to look at and consider for trying to mitigate concussion injuries? I mean, some of these we've already talked about, but if you could just sort of give a summary of what you think are the main things, or what are some of the main recommendations given by some of the larger bodies?
Yeah, so concussion prevention, there's many kind of factors
Mm,
and many areas that you can target. So, you can go from the top up, so top down approach.
mhm.
Government, sporting organisations, policy and rule changes.
Mm,
We're already seeing that with the stamp down or taking the tackle height down and taking those
yes.
high tackles more seriously because, concussions will occur from a blow to the head.
Well, it's actually interesting. Like I mentioned before we started, I played rugby union myself, and I don't watch much now, but I still do watch a bit of rugby union and rugby league. And there's certainly some big differences at the moment still with some of the tackle regulations, where rugby union has become very restrictive, but rugby league, you still got a lot more relatively higher tackles, a lot of
Yeah.
shoulder barges too, and seems to be. I wonder if that also is something that's stomped out over time because of the awareness of concussions, and I think particularly too, for future problems associated with recurrent concussions when you're younger.
Well, I'm going to say, look, I'm glad you asked that because now I'm going to
Mm.
probably talk more about what I feel and my opinions about all of this,
Yeah, yeah, please do.
as opposed to what research is saying. And I actually think that, yes, in order for these sports to continue and to be successful and to get the grassroots numbers up, these
Mm,
changes need to occur.
mm,
You need to make sure that the athletes are protected. So I totally agree with, all of these factors and that do make it safer for those athletes participating.
mm.
Because, if you're a parent watching footy and you see, those big concussions from a, shoulder to the head, every time you see that, there's going to be a parent out there that goes, oh, yeah, that's why I'm not letting my kid play contact sports. So
Mm,
I
mm.
do think times have changed and that needs to be something that we need to actually, support going forward. I hear all the time, the game's gone soft and things like that. But unfortunately, in order for these games to continue, to be sustainable, lawsuits, etc., like you need to be
Wow,
shown to have a
yes.
very proactive approach to reducing the risk and making sure that the player welfare is kind of looked after here. So
Yeah, for
totally, yeah,
sure. And look, it's an interesting one too, because as the only problem that you have, and obviously it's a competing or financial interest, is how that affects the visuals of the game as well, and how it slows down. Because certainly in rugby union, you see a lot more yellow or red cards from tackles that may seem somewhat just incidental, but are considered to be high risk, and therefore there's a consequence to that. And I'm sure for some of the larger bodies who are governing these sports, they probably look at that correlation between these changes to the success, like the viewing success. But like, I mean, I agree with you. There's obviously, we need to consider safety and the long-term percussions too. If there are a lot of people getting concussions and the impacts that it has on their, neurocognitive health later on.
yeah. I guess they're always tinkering with the rules, aren't they?
Mm,
How can we make a red card that doesn't actually impact them for the rest of the game? You've got the 20-minute
yes,
red card. So
yes,
those
yes.
are great. Like, the offending players removed from the game, but, the game continues 20 minutes later with the full complement of players. So those are nice
Mm,
changes, in my opinion. And I think, like, athletes will adapt. Like they've got to learn. Like that's part of
Yes.
that's what they're paid to do, or that's that's part
Yes.
of the rules. It takes a bit of time to get used to. Yep, of course.
Mm, mm.
I know with the sporting teams that we work with, when the rule tackle height changed in rugby union,
Yes.
across all the levels that I work with, everyone's going, okay, we need to really train getting it down.
Mm,
Here we are pointing at training it. Okay, yep, that would have been a yellow, that would have been a red card if that
mm.
occurred in a real game. So everyone's learning, we're adapting, we're introducing training to really try to, abide by these rules once again for the safety and kind of long-term health of the players. So I think it will get better. The game will continue to be, it'll work. It's just got to give it
Yeah.
time for those rule changes and for the athletes to adapt. And then
So you,
also quite an interesting, comment is from most of the colleagues in my office at the moment. Most of the, like maybe only one or two, but everybody else wouldn't let their kids play contact sport. So that's where I see this. Okay, well, something's got to be done,
that
and I
says
think
it
this is
all.
where you've got to show that these games are safe.
Yes.
We've got parents there that are saying no, don't want to let their kids play already. So,
Mm.
and I'm a absolute rugby fan. I would let my kids play. So it's like, okay, so you've got contrasting views. I know enough about it to go, okay, yeah, there's a risk, just like there's a risk in anything else. But yeah, obviously the higher in a contact sport. But how can we reduce that risk?
Yeah, and then I think part of that's also too, like you said, it is about rules, regulations, but I also then think about what things you're doing outside of the actual sport itself, because I do wonder if you start to see more and more implementation of certain types of resistance training protocols and things like that. And I even think about when I was at school. So I graduated in 2006, and I went to a big rugby school. And I remember there was slowly implementing a little bit of resistance training into, say, that the first 15's team development. Where I get the impression now it's much more heavily integrated at a teenage adolescent level, and so that's obviously related to an element of performance as well. But there's clearly some indications for that being beneficial for injury prevention, and whether we start to see more and more strategies to, say, optimize proprioceptive vestibular ocular function, overall tissue capacity, and whether that also is something that helps to mitigate the amount of concussions or injuries overall.
Yes, definitely. A lot of the schools are, like the kind of strength and conditioning side of things has stepped up a lot, and
Mm,
continues to step up. There's mandatory gym kind of program, for all the first 15 and development type of squads, and
yes.
all of those, yes, mainly focused on performance. But then, when you get stronger or when you get a bit better coordinated movement, that's already going to reduce that risk of getting an injury. One of
Yes.
the other things that probably does come out a little bit is that, tackle technique.
Yes.
So that all those skills involved in the sport, being more, proficient at it is going to improve or reduce your injury risk as well. So there's all of those that are going into this adolescent kind of group.
Mm,
And then slowly we will see. And, I know at the school that I work with, we're going to introduce neck strengthening as well.
mm,
And because it is the rugby program, even if the evidence is still a little bit, okay, is it going to prevent concussions or not? We know that that's going to be useful in the contact and the kind of, scrums and the rucks and mauls component of the game anyway. So we are seeing that. And absolutely, there's been a focus, I think, in the last 5 years or so of the neck region in strengthening that.
mm.
Definitely there is that bottom up approach to preventing concussion. What can the athlete do? They can, get stronger. They can target those areas that we've identified. Mainly strength, probably.
Mm.
Proprioception, we haven't, got any kind of really strong kind of strategies for, say, improving that.
Yes.
And then, like just their skills, tackle tech and all of that definitely comes into, getting the head in the right place, foot movement and all of that. That's really important as well so like I said, multifactorial in terms of, contributing factors to concussion.
What do you like to do outside of your professional work, Felix? Do you have any particular hobbies or interests you're pursuing at the moment?
Oh, that's at the moment. No, look, I've got a nephew who's turning 1
Oh,
very
yeah?
shortly. So love getting around, going around there and having fun with my nephew.
Sure.
Um, Not too many other hobbies at the moment. Rugby is probably the main thing, whether it's physioing on the sideline or watching it. Like,
Yep.
I do quite enjoy watching my sports.
Yeah, great. Do you are you more of a rugby union or league fan?
Oh, probably more rugby union.
Mm.
Well, rugby league's good to watch. The Broncos did quite well last year.
Really?
Definitely got around
Last year they
them.
had a. What do you mean? Oh, last year they
Well,
did.
no,
Sorry,
last
this
year's
season.
2023.
No, they
This year, not
did.
so good,
This
but yeah.
season, yeah. Well, no, it's rugby union's an interesting one though too, because rugby union in Australia has gone through some rocky periods actually, as of more over probably the last 10 years. But it'll be interesting to see if that changes over time.
Yeah, no, it's interesting because we've got the World Cup in a few years' time, the Rugby
You
World
do,
Cup.
yeah, yeah.
So hopefully that kind of sparks some interest in greater kind of numbers in rugby and
And
getting
hopefully some stability with the coach and
the
for the
coaching.
Wallabies
Yeah, I
over the
was
next
going to
few
say as
years.
well. Yep. Hopefully we're on the way up with rugby.
Yeah, yeah. Felix, thank you very much for being with me this morning to talk about your research. It was really fascinating to talk about. I think an important topic that we obviously see more and more people talking about, but probably don't hear a lot about, in general conversations like this. So I appreciate you coming on.
Thank you very much, Jack.
All right. And for our listeners, please do, wherever you listen, please do like, subscribe, and do leave a message just to help us be able to expand our reach and getting new listeners. Thank you very much.